Welcome to Pathology Navigator. Today's topic is hereditary spherocytosis. Pathogenesis. It is autosomal dominant disorder. Defect in membrane protein, most commonly ankyrin. Due to unstable membrane, RBC acquires a spherical shape and become more fragile, being easily destroyed in spleen, that is extravascular hemolysis. Clinical features include pallor, jaundice, splenomegaly, increased risk of gallstones on lab tests, hemoglobin, decreased, MCHC, increased because of loss of potassium and water due to dehydration, red cell distribution width, increased, reticulocytes, increased, peripheral smear shows spherical RBC characterized by no central pallor. Diagnosis. Screening test is osmotic fragility test. As spherocytes are more fragile, osmotic fragility curve shifts to right. Confirmatory test is EMA binding test, done by flow cytometry. Treatment. Splenectomy, decreased destruction of RBC in spleen and thus anemia is corrected. Because of splenectomy, peripheral smear shows how old jolly body.